Way to Paces, the right way.
Right. Hello, everyone. This is one of the free sessions from Way to Paces, Station 5. And before going into the session proper about the discussion and role play, can anyone tell me what is the structure of Station 5 in terms of minutes?
Yes, sir. Structure 5, I think it has got 14 minutes for brief clinical consultation. And then I'm not sure, I think 5 minutes for examiner.
Yeah, it's 2 stations at station 5. You
Yep.
have to see, 2 patients, and you have got 10 minutes for each station.
Okay.
10 minutes for each station, and
Yep.
you will have 8 minutes with the patient and 2 minutes with the examiner for each case. So total 20 minutes.
Total 20. So 8 minutes with the patient and 2 minutes with the examiner.
Yeah, and there are 2 cases, so
2 cases.
total 20
Okay.
minutes.
So with the 8 minutes, how we are going to, when do you get the warning? How we are going to time it in Station 5?
It's you'll get the warning
sorry,
at
one second. I could hear some small little baby's voice. So anyone in the background, can you mute it?
2 minutes for history.
Yep.
2 minutes for examination.
Yep.
And 2 minutes for any other missing things.
Yep.
And 2 minutes for addressing the concerns.
Right. Excellent. That's what I suggest. And again, it's individualized. You can do any little things you want, but you have to get back to the 6th minute when you get warning. Everything stop, wind up, and patient concern. Because patient concern has got marks in it specifically. If you miss patient concern, we don't get that part of the mark. So anything you stop, patient concern, 2 minutes, and then 2 minutes with the exam. Yep. Okay. So you are familiar with the timing. So it would get started, and then 6th minute, I'll give you a warning. Then you have to stop. 2 minutes patient concern, 2 minutes examiner, and it's done. Okay. Right. I'll give you the scenario now, and then I will time it when you're ready. Right. This is a scenario. 65-year-old Paul Grex was found to have hemoglobin of 200 gram per liter on a routine FBC, full blood count. Please take focused history, do focused examination, and answer his concerns. Right, I'm going to time now for 6 minutes. Okay, ready? Yeah, ready, you can go.
Hello.
Hello.
I'm Dr. Arul,
Yeah.
one of the doctor in this clinic.
Mm-hmm.
I'm here to speak about your problems you are having, and
Yeah.
based on it, I will examine you, and we will come to over the management plan further. Is it okay with you?
Yeah, fine.
Okay. Before proceeding, are you Mr. Paul?
Yeah.
Okay. May I know more about your problem, like how it started?
Oh, I don't know. I've just wanted to check a routine blood test, and then it came up like that. So, and people said the my GP said the blood count is so high, and that's why I don't know what to do. He referred me to the hospital.
Okay. So you are having no symptoms right now, right?
No, as such, no.
Okay. And before proceeding to examination, I need to once again reconfirm any to see any complication you are having.
What complication you mean?
Yes, I will ask one by one. Okay. Do you have any blurring of vision? I mean, visual disturbances?
No.
Okay. Do you have any tingling of fingers or altered perception of sensation in your fingers or toes?
No. No.
Do you have any leg pain?
No.
Do you have any chest pain or breathing problem?
No.
Okay. Any loss of consciousness in the past?
No.
Okay. Any weakness of any difficulty in using your arms and legs?
No.
Okay. Any joint pain?
No.
Okay. Any skin rashes?
No.
Okay. I have a few more personal questions. Do you smoke?
No.
Okay. Do you drink alcohol?
No.
Okay. Okay. Have you ever been? What's your job?
Sorry, have you ever been?
Sorry. What's your job?
I'm a carpenter.
Carpenter. Okay. Do you drive?
Yep.
Okay. What type of vehicle?
It's it's a carpenter car van.
Okay. Whether any of your family members have any type of problems which is running in your family?
Except for the diabetes, nothing much.
Okay. Do you have any other medical conditions I have to be aware of?
No.
Any surgeries you have undergone in the past?
No.
Okay. Are you on any medication now?
No, once in a while, just take a couple of paracetamol for body aches and things apart from my work.
Okay. I have one more personal question, one which should be confidential. And do you use any recreational drugs?
No.
Okay. Okay. Let me examine you.
Yeah.
From the I am standing at your foot end. Can you show me your nails for me?
Nails fine.
Okay. Okay. I'm going to check your pulse.
Pulse fine. 82.
Okay. I'm going to check your neck and axillary area for any enlargement of glands.
Right. I will give you an answer. It would take a bit of time. You won't get immediately the answer. I assume you're examining at this time. Normal.
Okay. Can you open your mouth for me?
Yeah, fine. No problem.
Okay. Can you draw your lower eyelid down for me?
Yeah, it's fully plethoric.
Okay. 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 Next, I am going to examine your chest for breathing sounds.
You have to wait. I'll tell you the answer. Normal.
Okay. And I want to hear the
time is up.
Okay.
You've got 2 minutes with the patient.
Okay. Do you have any concern?
Yeah. What am I having on what's going on with me?
Okay. You have a condition called polycythemia. Don't be no need to worry about the terminology. Actually, it means your hemoglobin count is very high. it has multiple causes.
Okay.
It may be uh, due to some genetic problem, or it may be due to some other secondary problem, or it may be a pseudo problem. So pseudo problem means it may mimic this condition, but with the hemoglobin level increase means we come to a conclusion that it's a problem for you.
So you don't know what's the problem now.
Yes, we know the problem. This condition is called polycythemia, in which the
Why this is happening?
Actually, there are two conditions here. One is due to a genetic problem. The gene is altered, and due to which it is due to a problem in your red blood cells.
Okay.
So it is produced more in amount.
Okay.
And sometimes it may these red blood cells will clump together and will block the blood channels, and it may lead to some problems like stroke or heart attack, or it may block some small channels and it will lead to some other small blood channel related complications.
Time is up. That's all, right? Right. Okay. Come out of everything. What do you think? How did it go?
This is the first time I am doing station 5, sir. So,
Oh, right. Okay. See, for that, I would say that's brave. See, overall, history part is okay because you got a structure in you. You got the diagnosis. You're thinking about different things. History part is okay. I wouldn't say excellent. History part is okay. But the way you are telling, needs lots of improvement. And also in terms of examination, you have to be sleek and quick. You can't say, you said 2 minutes, 2 minutes, 2 minutes. If you time it, you didn't examine even less than a minute. So it won't be enough at all in the exam. Less than a minute, you can't do anything. And in terms of communication, explaining concerns with the patient, I don't think what you have done was right. It could have been done in a different way. Because you couldn't finish examination, you can't have anything, and then you couldn't tell anything over there. So this is the overall feedback. If you want an individual feedback, so first of all, you said speak about your problems and then examination, not needed. Nothing is needed here because there's no time here. It's not history taking. People will know you are running out of time. You just go on to that. I'm so-and-so. You are Mr. Paul. Okay, you got a blood count with a red cell higher count than normal. Okay, tell me more about it. That's it, finished. Just jump onto it. No need to waste time. Is it okay to do it? Can I lift your arm? Can I? Nothing doing that. In station 5, it's just like a robo. 1, 2, 3, 4. That's it. So you wasted nearly lots of time over there. And then you said, I want to check your identity. No story here. Just, are you Mr. Paul? Yes, finished. Or if you don't want to say Mr., just, are you Paul Greggs? Okay. And then just, even you don't want to ask, how would you like to be called in this situation? In history taking, yes, you've got plenty of time. But in station 5, no softy things. Straight on to the task and then do it, because every second matters. And you said any symptoms. I would avoid the word symptom. I would say any problems straight with, and why are you here for? And that you can say complications. You said, I need to look at the complication. That's a very big word. Even without knowing what it is, you can't tell about complications. So I would say, I know what you're trying to tell, but if it's a surrogate, they don't know what you're going to tell. They will mark you completely down for asking all these things. So be careful about the word you choose and how you speak. In terms of history, I think you covered mostly visual disturbances, tingling, leg pain, chest pain, difficulty, joint pain, skin rash. Why do you ask leg pain?
Leg pain means hyperviscosity syndrome.
Okay. right? And you ask about medical condition, family history, surgeries, medications, recreational drugs. And again, recreational drugs, I know it's a sensitive, and then you have to say it's a personal question and things. In section 5, you can just jump in. Nobody is going to worry about it, because if you say every second is important here, okay? And in terms of examination, because we are doing virtually, you're just asking, show your nails, and then you're asking me. But it's not a complete. So even with the station 5, it's not complete to practice virtually. You have to practice face to face. That's the ideal way. But because we are in different countries and different time zones and things, we are doing it. But even then, you need to be a little bit careful. And then you said neck and auxiliary region, and then mouth and normal, and don't ask them to pull. See, you can do it. Can I lift your, and even then you can't ask, just like, can you give a glass? I'm going to look at your eyes. That's it, finished. There's no time for each and everything to command and things. As much as possible, you do. And when you practice station 5 physically face to face, you know the timing. See, with the chest and all, I don't know how you people are practicing. If you practice like, okay, chest examination, somebody says, yes, it's normal. Heart sounds, oh, it's normal. Legs, normal means that is not right, because you can't finish chest, heart sounds, and leg within 1-2 seconds. You need some time. You have to do it. And then when you practice, do it like that. And patient concerns are, unfortunately, I have to mark you completely wrong for the patient concerns, because you have not told anything convincing. If you don't know, you have to say, we are thinking about it. So what you said was polycythemia, multiple reasons, genetic, secondary, pseudo, and again, pseudo is a different word. You yourself don't know what you're talking about. Then you said about altered gene, but you're trying to scare people in terms of blood channels and stroke, heart attack, blah, 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 everything. They'll be completely stressed out when you do that. Because all you need to do is, so you can say honestly, I didn't have time to examine. I will ask more questions. I will examine you a little bit more. I can't do within this time frame. I'm so sorry. So there are multiple reasons. I need to do some tests on you, and I will get help from blood, like a specialist, like a hematologist, and then we'll take it from there. At the moment, we don't know what you're dealing with, but you will get answers soon. So if you don't know what you are, I don't say this is an uncommon presentation, because people are getting it. That's why I've chosen this rather than chest pain, shortness of breath, visual disturbances and things. So that's what I would say. The first initial introduction bit, you need to be careful. And then symptoms wise, yes, it's okay. And again, examination, you need to give a break and things. You can't expect answers to be there. Concerns, you need to be honest and tell what is in there. Why do you ask driving?
Sir, suppose if he is having any visual disturbances, then could be a problem with the driving.
That's again, like I see, we don't have time to roam around. If this is there, if that is there, no, is it there or not? History taking, yes, you've got plenty of time. You've got like a thorough. Here it's only focused. So if it's not related to an eye, I pulled it, isn't it? I purposefully pulled it. Driving means if you drive, that's okay. And you ask me what sort of vehicle, again, have to pull it like a car, van. That's it, 30 seconds gone. It's a waste of time. There's no relation to this, unfortunately. Okay, so don't take a time like scrutinizing and critically telling everything, but it's only for your good. I will be honest. I won't tell you a lie and say, Arulmoli, you did fantastic station 5, and you will go with the wrong notion. So whoever does the role play with me, I'll be just right. It's not about strict or not strict. I will tell you what is exactly needed. I'll give you feedback so that you can correct it next time. Anybody else wants to do? I don't know. There is enough time. Anybody wants to do again the same role play? Okay. The same scenario, same 6 minutes. I will stop you. Okay.
Sure.
Start.
Hi, I'm Dr. Sarva in the clinic today.
Hello.
Is it Mr. Greggs?
Yeah.
So, Paul, Mr. Greggs, I've been asked to see you in clinic as you've got some blood tests, routine blood tests done, and your GP has sent you to me. Can you tell me, are you suffering from anything at all?
Sorry, what is that?
Are you suffering from anything at all?
No, this is a general routine test.
Any problems? Have you had any problems?
No.
Okay, let me ask you some quick questions then.
Yep.
Any headache at all?
No.
Have you noticed any symptoms, eye symptoms?
No.
Any pain to your chest?
No.
Have you had any shortness of breath at all?
No.
Okay. So do you sleep well at night?
Yeah.
Do you snore a lot?
No.
Okay. Any pain to your tummy?
A little bit on the left side of my tummy. I don't know why. It's like something is like a heavy. I feel a little bit heavy.
Okay. Is it more like a discomfort?
Yeah, it's something dragging on my tummy on the left side. I don't know why.
Okay. And for how long you've been having that now?
I would say for a few weeks, but I'm just thinking eat too much and then that's there, and I've started exercising. So I myself reassuring me that nothing is there.
Okay. And apart from that, have you also noticed any change in your bowel habits?
No.
Okay. Any problem with your waterworks?
No.
Okay. Any pains or anything in your joints?
No.
Okay, that's reassuring. Okay. Now, you said you've got some pain. Have you had any vomiting as well?
No.
You have had no vomiting. And have you noticed any change in your weight?
No.
You're eating and drinking well otherwise?
Yeah.
Okay, that's good. So, Mr. Greggs, do you smoke?
No.
And do you live in some high altitude areas by any chance?
No, not really. I love to.
Okay. And do you drink alcohol?
No.
Have you done any recreational drugs at all?
No.
And have you been diagnosed with anything at all?
I'm a diabetic.
Okay. And are you on insulin by any chance?
No, I take metformin.
You just take metformin, and it's well controlled.
Twice daily.
Okay. And apart from metformin, do you take any other medications at all?
No.
No. Okay. And do you have any family history of any conditions similar or anything?
Diabetes, like both the parents and all the siblings are diabetes.
Okay. And no one in the family has hemoglobin of being on the higher side or
No,
anything?
hemoglobin is fine. This is out of the blue, actually.
Sure. Okay. So, Mr. Greggs, is it okay if I quickly examine you?
Yeah.
So I'm going to examine your fingers. Yeah. Can you just stretch your arms out for me?
Normal.
Okay. And now I'm going to feel your pulse.
82 per minute.
Okay.
You won't put it minute, but you will multiply it. Okay.
I'm just going to quickly pull your eyelids down. Is that okay?
Yeah. Bright red, toric.
And can you open your mouth for me?
Fine.
Okay. I'm going to just feel the lymph node in your neck now.
Normal.
I'm going to lie you flat and now examine your tummy. Okay. So first I will do a softly, and then I'm going to press for see if there's any enlargement of any organs. Yeah.
Okay.
So first palpation, all 9 quadrants.
You're feeling enlarged spleen.
Okay. Now I would individually again check for spleen and percussion of spleen.
Yeah, it's enlarged 5 centimeters below the left costal margin.
Okay. I will also quickly listen to the heart sound now.
Normal.
And listen to his lung space.
Normal.
Okay. Now, Mr. Greggs, I've examined you now. Do you have any questions in particular at all?
Yeah, I don't know what's happening with me. What's going on?
That's right. Do you know what might have been going wrong with you by any chance?
I don't know. No clue. See, apart from, I'm a diabetic. I usually check my blood test routinely, and this is the blood test I've checked. I'm diabetic for nearly 10 years now, so never had any problems due to that. It's well controlled. And suddenly the GP said your blood count is high, and then I want to send you to the hospital. I don't know no clue.
That's right. So yes, you have got your hemoglobin, which is on the higher side and which needs to be investigated. As of now, we are not sure as to what is happening. But the good thing is that you have no symptoms apart from you you don't have any problems apart from you notice some kind of pain to your left upper tummy.
2 minutes with the patient.
Sure. So it looks like you have got one of your organ inside your abdomen slightly enlarged.
Oh, right. What is that?
So we call it as spleen. We think your hemoglobin and your spleen might be interconnected with each other. So what we're going to do now is we're going to do some more blood tests.
Where is it? Where is that organ in my body?
So it's in your tummy. If you like you said, you have some kind of discomfort on the left upper side, and that is where you have the spleen.
Oh, right. So that's why I'm having problem. Okay.
That's right. So what we're going to do is we're going to start by taking some blood tests today. I will send some special blood tests for you. And we will also do a scan of your tummy, the ultrasound scan, to confirm that you have enlargement of your spleen.
Yep.
And we will have further follow-ups. We do not need to start any treatment yet, but you have to be aware of some visual symptoms or headache or anything if you develop. Yeah, these are one of
what does that mean?
So if you have any blurring of vision or if you have headache, you need to come to the hospital, because when your hemoglobin is slightly too much, you can have some kind of complications. But as of now, there's
what complications like? So if I have anything problem, so what you are trying to tell me?
So if you have any visual symptoms or anything, you need to come to the hospital. It could be that it has affected some part of your body, like your brain or your eyes.
Okay, right.
But as of now,
like a block.
Yes, that's right.
All right.
But as of now, there is nothing to be worried about. Like I said, we're gonna get some blood test, get the ultrasound scan of your tummy, and I will then refer you to hematologists. They are the specialist who deals with all this kind of things. Okay.
Right.
So, Mr. Greggs, can you just recap everything that I told you?
Oh yeah, you told there's some problem there, and my tummy, there's some organ is a bit enlarged, and you're going to do a test, a scan, and send me to a blood specialist. Time is up. Examiner time. Right. What's your diagnosis here?
Well, I think Mr. Greggs is suffering from polycythemia, and he has got enlarged spleen. So I think he has got polycythemia rubra, which needs to be further investigated.
Right. How do you diagnose?
So with regards to polycythemia rubra, it's we need to get blood test done. That is full blood test, and that we're gonna look for hematocrit and red cell mass, and we will also send JAK2 mutation. If he's got JAK2 mutation positive with raised hematocrit, then that is the diagnosis. If it's a JAK2 mutation negative, then there is a criteria where we look for other things like spleen. There has to be no other cause of raised hemoglobin, confirmation of ultrasound, splenomegaly, and probably other. How
do you treat polycythemia rubra?
So for polycythemia, first is venesection to bring the hemoglobin down. And secondly, we can use long-term hydroxyurea and long-term aspirin.
Time is up. Thank you. Okay, that's good. Good, I would say. And people who are watching as well can know the difference in this one. So overall, I would say it's good. You've got a very good history, and then you examine with the gap. That's a way to practice, and you have done it very well. And I did give a clue in terms of splenomegaly and things. And investigations, you told you don't know, and then over there, and the specialist referral, ultrasound, everything. My personal feedback to you was, unfortunately, you're using the word suffering a lot of times, so you need to cut it down or stop it completely, because we don't use the word suffering here. So suffering is just like whenever people say suffering, they only mean the dying, end of life, huge distress. They won't ask in terms of What are you suffering from? So I think the suffering, we have to take that off. And then other things are fine. You've got a good pace and then good flow and things. Job, occupation, we have to ask in station 5. So that's a must. And then other things, you've done it. Say current problems, past medical history, surgical, current medications, allergy, you have to ask.
Yes.
If you're planning in terms of any medications or anything over there, you need to ask. And again, the relevant social, occupation, everything. Everything is nice. I would say you'll get through this, station 5. If you get this, there's no problem with the station 5 for you. Even though it's a little bit uncommon case of giving like hemoglobin high hematology. And the suggestion I give for everyone is, yes, you practice everything for station 4 and then 2 and 5. Yes, you do all the commons, but please do uncommon ones as well once in a while. And I'm hearing from people, they're going all the common things and then they miss the uncommon things and they don't know how to approach. Still, there might be something we don't like it or we're not familiar with it. We are not an expert in it. But still, if you know the basic one, you can get away with it. At least you can say, I don't know at the moment, so I'll get help from seniors. We'll do the test and come back rather than going blank completely. So I would suggest everyone to do that. No question?
Dr. Tanveer from Bangladesh.
Yeah.
I would like to ask, what are the points in history that must be touched? I mean, other than symptom analysis of the presenting symptoms. For example, what points in social history that must be touched? Because the time is there is time constraint, so we will not be able to ask everything. So what points should be touched? What points are the must?
The first thing is, as you said, the problem, and then history of the problem is a must. And then past medical history and past surgical history, current medications with allergy status, and they say relevant personal, social, travel history. Relevant personal, social, travel, and occupation is a must. I'll repeat again. History taking, history of current problems, past medical history, past surgical history, current medications, allergy, occupation. These are a must. And on top of that, relevant personal, social, or travel. See, relevant personal is a must as well in terms of like a smoking alcohol is a must. And depending upon if you're talking about seizure, you can ask about driving. And if you're talking about the fever, you can ask about travel. But I guess fever won't be there generally in station 5, unless it's only malaria coming from, let's say, overseas, India, having fever. What's the first diagnosis of malaria? Until it's pinned down, I don't think they will include fever in this. So these are all a must. And then it's just like a rapid fire. You need to go on and on and on. Okay?
Okay, sir. Yes, sir. Thank you, sir.
One more question from the chat. How much time should be given to history as opposed to examination in BCC? So again, people have different views. So as we said, total 10 minutes. Forget about the 2 minutes with the examiner. We can't do anything. And 8 minutes, again, I would say forget about the 2 minutes with the patient concern. So we have to play only with the 6 minutes remaining. Within 6 minutes, we have to take history, we have to examine. General advice is you can combine examination and history. If you are multi-talented, multi-skilled person, you can combine that, shortens the time. But I don't prefer to do that way. Taking history and examination, it's a preference. It's because I might miss something important. That's why that's my own style, and you can have your own style. If you can combine, that's good. If you can't combine, I usually say the prime history is 2 minutes, the prime examination 2 minutes, and another 2 minutes you can have like whatever left, and you suddenly think, oh, I've not asked about history of like a medication, allergy and things. Generally, if you start with past medical history and medications, you will get 50 to 60% of the diagnosis right. Clue. But again, it's a contrary from what we have been trained. We usually ask the presenting complaints, history presenting complaints. But when I say contradictory, the Royal College of Physicians, the medical masterclass recommends to do that. Station 5, Try to do that. If you're in the middle of the practice and having an exam soon, don't go this way. Just go with what you have practiced already. But if you're brand new to station 5, you've never done station 5 before, just you've got plenty of time to do it, try this. Ask past medical history first, and then medications list with allergies second. Then you know exactly what's going on. Then you come to the problem, presenting illness, all the other relevant personal occupation. Then you come to a conclusion. That's lovely. Thank you. Bye-bye.
Way to PACES, the right way.